7 warning signs your loved one's future hangs in the balance. An insider's guide to the life and death choice to take control of drug abuse. Conquering the status quo of American society. The 5 critical steps to overcoming everyday pressures that lead to addiction. Areas covered. Challenges threatening the stability of American families. Prescription drug abuse, a national epidemic. Is someone you love spiraling out of control because of drug addiction? What to do when you can no longer watch a loved one destroy his or her future. Family time is a rare commodity. In a 24-hour period, an average American adult works 8.2 hours, spends 45.8 minutes commuting, watches 5.5 hours of television or other media, engages a mobile device for 35 minutes, sleeps 6 to 8 hours. Over the last 25 years, the time parents spend with their children has dropped 40%. On average, parents spend only 2 hours each day with their children. What is happening to our personal connections? Marriages and families are falling apart. First marriages, 50% end in divorce. Second marriages, 67% end in divorce. Third marriages, 73% end in divorce. All of these pressures overwhelm our senses. Nearly 50% of Americans say their stress has gotten worse in the past 5 years. And less than 33% feel they are managing their stress well. 30% say family worries are the biggest source of stress. The pressures intensify in college. The emotional health of college freshmen has declined to the lowest level in 25 years. The percentage of students who say that their emotional health is above average has dropped 12% since 1985. Parents never stop worrying about their children. 76% of parents feel they can never let down their guard against the influences of popular culture, drugs, and crime. 50% worry more about protecting their children from negative social influences than about paying bills. 60% rate their generation as only fair or poor at raising children. Every generation faces unique challenges, but no previous generation has been forced to cope with a culture in which alcohol and drugs are so available and tolerated. If you think your loved one has not experimented, you're wrong. The first use of drugs starts young, 14% at age 11 or younger, 56% between the ages of 12 and 14, 30% between the ages of 15 and 17. Teen brains are primed for risk, including experimenting with drugs. 90% of addictions begin in the teenage years. 1 in 4 teens who begin using a substance before the age of 18 become addicted. Just 1 in 25 people who begin using a substance at age 21 and older become addicted. Some teens are at even greater risk because of genetics, family history, and mental health or behavioral problems. Not my kid? Think again. In a 12th grade classroom of 32 students, 16 have tried drugs at least once in their lifetime. 13 have used 1 or more drugs in the past 12 months. 8 have used an illicit drug in the past 30 days. Substance abuse does not discriminate. It affects people from all walks of life, socioeconomic backgrounds, and education levels. College partying comes at a high price. 159,000 college freshmen drop out because of alcohol or drug use. 110,000 students are arrested for public intoxication or drinking and driving. 31% miss a class. 25% experience academic consequences, such as failing exams and low grades. Consequences can last a lifetime. 70% of students have unplanned sexual encounters as a result of drinking. 50% of campus rapes involve alcohol. 97,000 people are sexually assaulted by intoxicated students. Alcohol abuse has devastating consequences. Combining alcohol and drugs can be deadly. Young adults are at particularly high risk for excessive drinking and for alcohol and medication interactions. Poisonings from prescription opioid pain medications and related narcotics increased 122% in adults ages 18 to 24 between 1999 and 2008. An alcohol overdose was present in 20% of the poisonings. How does this behavior begin? Children learn how to cope with life's challenges by watching and listening to parents, peers, and the media, and the consequences can be catastrophic. Let's discuss. Parents are a powerful influence. Children who start drinking at age 15 have a 40% chance of suffering from alcoholism or alcohol dependence as an adult. Legal or illegal, marijuana contains 400 brain-altering chemicals. 30.2% of college students used marijuana in the past year. 17.2% are current marijuana users. Pot potency. Not your average dirtweed. The THC in marijuana is a whopping 1,200% higher than it was in 1976. In the last available government data, the average THC content in the U.S. was 8.52%. Comparatively, in 1978, it was 1.37%. In 1988, 3.59%, and in 1998, 4.43%. Unofficial estimates put the 2012 THC levels in the low 20s. Scientists predict 50% THC will arrive in the near future. There's a new dope dealer on the block, and it may be you. 15% of high school seniors say they have taken at least one prescription or OTC drug for non-medical purposes in the past month. 25% of teens say they have taken a prescription drug not prescribed for them at least once in their lives. 23% of teens say they have used a prescription painkiller not prescribed for them by a doctor. Prescription drug abuse often starts at home. 63% of teens say prescription drugs are easy to get from the medicine cabinets of friends and family. The number of emergency room visits attributable to prescription drugs jumped 97% between 2004 and 2008. The CDC has classified prescription drug abuse as epidemic. A deadly marketing misconception. 40% of teens believe prescription medicines are much safer to use than illegal drugs. 31% believe there's nothing wrong with using prescription medicines without a prescription once in a while. 76% of the 12 million Americans abusing prescription drugs are taking drugs that were prescribed for someone else. Every day, 2,500 teens use prescription drugs to get high for the first time. 60% of prescription pain reliever abusers started before the age of 15. 56% reported prescription drugs are easier to obtain than illicit drugs. 33% of teens believe that prescription pain relievers are not addictive. Attitudes towards drugs are formed early, but parents still influence their child's choices even as young adults. Opiate abuse is fueling a dramatic spike in teenage heroin use. The reason? Heroin is a bargain compared to prescription opiates. A single pill of Vicodin or Oxycontin can be anywhere from $40 to $75, while a small bag of heroin may cost less than a six-pack of beer to achieve the same high. For anyone already addicted to prescription opioids, cheap, accessible heroin may seem like a much better deal. Despite a 98% increase in overdose deaths since 2002, we have developed a culture of solving problems with pills that threatens our nation's health. Let's explore another disturbing trend. More than 60% of American adults use at least one prescription drug. Sales of prescription drugs have increased by 252% over the last 2 decades. A startling 74% of Americans who visit a doctor leave with at least one prescription for a drug. Stimulants used to treat ADD are also abused in search of a competitive edge. 50 to 60% of college seniors have abused prescribed stimulants such as Adderall and Ritalin as a study aid. What many college students don't know is that mixing Adderall and/or Ritalin with alcohol can result in mania, breakdowns, and psychosis. Why spend on R&D when the current drug portfolio is so profitable? Since 2008, 4 out of the top 12 pharmaceutical companies have increased profits by more than 20%. Merck profits grew by 65.2% in 2008. R&D spending was cut by $316 million. The pharmaceutical industry spent 200% more on marketing than research and development in 2008. But can we trust the research that is published? Between 1987 and 2004, the FDA reviewed 74 antidepressant studies. 37 of 38 favorable studies were published. Just 3 of 25 unfavorable studies were published. 11 other unfavorable studies were published, but twisted to seem favorable. Advertising for drugs crosses ethical boundaries. Each year, pharmaceutical companies spend about $4.5 billion on advertising, and it works. When patients request drugs they have seen advertised in the media, doctors write the exact prescription 70% of the time. Conflicts of interest are far too common. A study published in the Archives of Internal Medicine found that a majority of doctors on drug approval panels have conflicts of interest. The conflicts are quite prevalent, but by no means ubiquitous. Dr. Kirkpatrick, assistant professor at Penn Med School. To make matters worse, the market is flooded with ineffective drugs. Between 1995 and 2004, 66% of new drugs on the market were Me Too drugs, or those extremely similar to other drugs on the market. A whopping 85% of drugs hitting the market have been found to provide little or no benefit to patients. We want to trust the medical community, but can we? More than 25% of doctors receive money from pharmaceutical companies to help market their products. 50% of physicians admit to routinely prescribing treatments they don't think will help because of drug company incentives. Psychiatrists earn nearly 200% more per hour prescribing pills than providing therapy. Market and cultural forces are combining to create a perfect climate for drug abuse. Americans realize there is something fishy going on. But how do you fight this giant? 88% of Americans don't consider pharmaceutical companies honest and trustworthy. This leaves many caught in a painful contradiction. Their health may depend on prescription drugs, but they don't trust the companies that make them. Besides pharmaceutical marketing, what other societal trends are fueling the rampant abuse of prescription drugs? Let's discuss 3 contributing trends. Number 1, availability of painkillers. Number 2, societal acceptance. Number 3, rise in mental illness diagnosis. A drug abuse problem can mask or aggravate a mental health disorder. Nearly 1 in 3 teens between the ages of 15 and 17 who are being treated for substance abuse also have a psychiatric disorder. Males and females are almost equally likely to have a co-occurring psychiatric disorder. Denial is a powerful and often deadly emotion. The figure of those in denial about their drug abuse is estimated at more than 4.6 million. With physical and psychological survival in the balance, intervention is often a life or death decision. But not all rehabs are equally effective. Seek out these key elements for optimum success.